Good evening, everyone. Thank you so much for coming. Thank you for being here. It's so great to see you all. It's so great to see so many friends and colleagues. It's been way too long since we've been in the same room together, so welcome, and it's so great to have you back. And it's great to see so many new faces as well in the room tonight. That's amazing. We're really excited to bring you all in on this, and we hope that by the end of this evening, I'll slow right down. We hope by the end of this evening, you are as excited about the campaign as we are. So we have some pretty badass women speaking with you this evening. You're welcome. But I'd like to start by inviting to the stage the incredible Dr. Natalia, Executive Director of the United Nations Population Fund.
All right, well, I intend to live up to that. Good evening, and it really is wonderful to be together and to see everyone in living 3 dimensions. I want to deliver a pointed message on behalf of UNFPA, which is the United Nations Sexual and Reproductive Health Agency, and that is to trust a midwife. And we must double the midwifery workforce by adding at least 1 million more. Over UNFPA's many proud years of collaboration with the International Confederation of Midwives, we've bolstered our mutual commitment to bring data, to bring evidence, to bring the facts to bear. But that is not enough, not in the world in which we dwell today. We must work together to assure that we strengthen the midwifery profession and improve maternal health outcomes. The goal is to make sure that this time around, by 2030, maternal mortality drops. And we're not necessarily talking about a woman. Very often we are talking about a girl. And it is the midwife who has that depth of understanding in her community to persuade a health system that is not always welcoming, that does not always open doors appropriately. No longer must women and adolescent girls give up their lives while giving birth. No longer must they fall victim to unsafe abortions. No longer must they fall victims to fistula, to harmful practices. Congratulations, ICM, 100 years. 100 years of setting the gold standard for midwifery education, for fairness in regulation all around the world. And UNFPA believes that midwives earn that trust every single day. We believe that midwives earn their respect every single day. And now, yes, midwives should earn their fair and just rewards every single day, everywhere. And as we innovate in what has been a fruitful partnership towards achievement of those Sustainable Development Goals number 3 and number 5, UNFPA is excited to partner with you. We really want to make a huge resounding success of the Global Push campaign. Together, we will push for a stronger health workforce with better job opportunities, with higher pay, with improved working conditions. COVID has shown us that respect for that midwife, respect for women in general, and greater support for midwives on the ground is a game changer. So let us close the midwifery gap. Let us bring a strong global reproductive health and rights movement, and let us add those 1 million midwives to the workforce. So we move forward together, we accelerate progress together, and we push for women, for adolescent girls, reproductive health and rights and justice. Good luck to us all. Thank you. Thank you very much.
Well, that was most of what I was going to say mine. Thank you, Natalia. Thank you, UNFPA partners. Okay, so to start, can I see a show of hands from all the midwives in the room? Yeah, that's a good turnout. That's a great turnout. Keep your hands up, keep your hands up. Okay, so can you now put your hand in the air if you've ever had a baby or might have a baby in the future? Your hands up. Okay, keep them up, keep them up. Hands in the air if you've ever needed contraception or an abortion or have supported someone who has gone through that process. Cool, cool. Has anyone struggled with their reproductive health or held the hand of someone who's going through that struggle? Okay, so that's almost all of us. Last one. Hands up if you've ever been born. So this campaign is for all of you. The Push campaign has women's right at its heart. The right to contraception, the right to abortion, the right to a safe birth, a birth of your choice, the right to respect, the right to be heard. It's about taking back the power and decision-making about our bodies and our reproductive rights. So how do we do this? I've got a short video.
There are women who work every day to protect women's lives, rights, and dignity during childbirth. Who could provide access to contraception for the 220 million women and girls who don't have the access they need? And who have the skills to prevent the loss of 2.7 million women and newborns who die needlessly every year in pregnancy and childbirth? These women are midwives. Midwives are trained medical professionals with the skills to save up to 4.3 million lives per year and provide 90% of a woman's sexual and reproductive health care. Midwives are activists, upholding a woman's fundamental right to a child by choice, not by chance, and ensuring a birth experience of her own design. Midwives are women, and they face the same gender discrimination that women all over the world face every day in their work. Midwives are some of the health profession's lowest paid workers. Around the world, midwives face violence, sexual harassment, and bullying at work. Midwives are left out of decisions about their own profession and the women they care for. When midwives' rights are abused, women and girls everywhere suffer. It's time to push. Push for women's rights, choice, and dignity in childbirth. Push for better pay and better treatment for midwives. Push for more funding for more midwives. Push for rights for women, for midwives.
That's good, right? That was good. 300,000 women are dying needlessly every year. And we know women are more likely to die when they are systematically discriminated against. Black women, women of color, poor women, women with disabilities, trans people, indigenous women. We cannot separate reproductive rights from other forms of discrimination and injustice. But when midwives could avert 4.3 million deaths a year, why are they not at the center of our health systems? When we know that midwives can provide 90% of a woman's sexual and reproductive health care, why are we short nearly 1 million midwives? There is a 16-fold return on investment in midwifery, and that's a fact. You can look it up, look online. So where's the investment? The failure to adequately invest in midwives, despite the evidence, shows that women are just not a priority. This is the case in the US, and it's the case in almost every other country around the world. This is not just a health issue, this is a human rights violation. And the result is that women and newborns are dying. And every one of those deaths cause a ripple effect of trauma to families and to communities, because these are not just statistics. These are people's lives, and they were loved and they are needed. And that's our health systems working at their very best. That's on their best day. That's before you add in a global pandemic, the climate crisis or war. We know that when crises happen, it is always women who bear the brunt. But when crises happen, midwives can still do their job, because midwives are in communities, they're in homes, they're meeting women where they are. Neha, who's a midwife and one of our push campaign coordinators, is in Pakistan. Yesterday, she was figuring out how to get a boat to access an entire province that's been cut off from the floods. In one day, she saw 120 pregnant women who would have gone without that life-saving care. So we need to shift our very limited understanding of what midwives do. Midwives are trained medical professionals, but they're also activists. They're first responders. They're community members, contraception providers, abortion providers. They're grassroots women's groups. They're trusted voices for vulnerable women. We need governments and donors to fund midwives like they value women, like they're listening to the evidence, and like they want women to live. We're going to push them to change public policy and unlock new funding. We're working with local partners, activists, and advocates to address the barriers that are preventing midwives from doing their job. And these aren't new. Pay and working conditions, education, harassment in the workplace, access to leadership. These are issues that women's rights advocates have been calling out for decades. Midwifery is a women's rights issue. The Push campaign will show the world what midwives can do. We are experts, we're activists, we're leaders, storytellers. We're midwives, not me specifically. We have big ideas and we know how to do this. We're here for the long haul and we want to get it right. And now I have about a 45-minute presentation to walk you through exactly how we're going to do that. I'm just kidding, it's a Sunday, I'm not going to do that. But what I will say is that if you are a donor in this room, look at your investment portfolio and ensure that midwives are prominent. They are the best investment you can make, and we're running out of time. Before I hand over to our incredible panel, let me acknowledge some fundamental partners. The International Confederation of Midwives, of course, who made all of this possible. And who recognize the need for something bigger than any one organization can do alone. I want to thank the donors who seed funded this campaign in its earliest days when it was nothing more than an idea. Ben Carl, Direct Relief, and the Gates Foundation. Your belief in the vision, your passion for women's rights, and your trust in this campaign has made it possible. There is significant work to be done, and we're excited to be with you on this journey. And now, I am going to hand over to our amazing panel. I'm going to show your video before you come up, and then we'll introduce them all. Thank you so much for your time, everyone. Thank you, thank you.
My daughter's story is loud, colorful, and artful.
It's a girl!
She was awake, aware, and active.
Hey, baby.
And yet she still died.
After she gave birth, Shamani was complaining that she had really sharp chest pains.
The ambulance came. I'm telling them the symptoms.
Is she on drugs?
Next set of people come in. Is she on drugs?
They kept asking her mother, is she on any drugs?
I'm like, do y'all talk?
We waited a solid 12 hours.
She's gone.
Black women are 4 times more likely to die than their white counterparts with the same symptoms. Why is that?
This is a growing epidemic in our community.
Hundreds and thousands of men are going through this same situation.
Oh, you couldn't tell me that I wouldn't be there.
I've never lived in this house without her.
You just gotta keep pushing forward.
I can't let Amber be another statistic.
I had a plan, I had got it mapped out.
If these numbers were flipped around and white women were dying at the rate that black women are dying, it would be a national crisis.
We fight against maternal morbidity event by event in order to create change. We can turn our pain into power and make something of this.
Shamani Gibson, we hear you, we see you.
I planned on spending a lifetime with Amber. I wanted to give her my life. This way I'm still going to.
Sometimes change.
The revolution will be tweeted, Instagram, Facebook.
This fight is not over.
When black mothers die, there's a ripple effect. We call it Aftershock.
Sometimes change.
Welcome to the stage, Paula, Tonya, Jennifer, Daniela, and Anna. Come on up, thank you.
Good evening, everybody. My name is Daniela Drandich, and I am the head of advocacy and communications at the International Confederation of Midwives. And I have the honor of being the moderator of this amazing panel this evening. ICM is the proud secretariat of the PUSH campaign, and tonight we're going to walk you through a lot of the issues that are happening here in the United States, where we all are this evening, related to the film that we just watched. I've spent my career advocating for women's rights when it comes to rights in sexual reproductive health, but especially in maternity care and in childbirth. And through this work, I've come to realize what women all across the world have realized when they are seeking care for childbirth, and that is that midwives are integral to getting a good childbirth experience. If we as community members want to ensure the health and well-being of future generations, we must begin well-resourcing midwives and midwifery. As advocates for midwives and midwifery, we're not simply advocating for improved health outcomes at birth. We're promoting a solution to address preventable maternal death, unsafe abortions, gender inequality, racism, climate change, and so many more things. A common thread linking the careers and activism of the women sitting next to me is the realization of the potential of midwives in responding to the most significant human rights issue of our time. And without further ado, I'd like to invite our esteemed panelists to introduce themselves.
Hi, good evening. I'm Tonya Lewis-Lee, and I am a co-director and co-producer of Aftershock, the trailer of the film that you just saw. I'm so pleased to be here tonight. Sorry, I forgot to turn my mic on. Did you all hear me? Yeah. Okay, great. So I don't have to say it all over again. I just want to say I really appreciate having this conversation specifically about what's happening here in the United States. I think often Black women, women in America get left out of the conversation, and it's really important because we are dying and we need to be a part of this conversation. So I just thank you all for inviting us to have this conversation here tonight.
Hi, I'm Paula Eiselt, the other director and producer of Aftershock. I'm so thrilled to be here in the presence of so many amazing women and midwives, and I love that we're talking about solutions. This is something that we can all do something about. So really happy to talk more.
Good evening, I'm Jennie Joseph. I'm a midwife. I have an organization called Common Sense Childbirth. I've been in the United States for 32 years at this point, and I got here as a midwife. So I had a rude awakening because I didn't know. I just got on a plane. And now I found out, and still all these years later, still reeling from the fact that midwifery is not normal, accepted, integrated, or part of the fabric of American healthcare for women. So that's why I'm here, and I'm glad to be here. It's time for this conversation.
Yes. Good evening, everyone. I want to say first that I was emotional just watching the trailer. I want to say that. Just want to say thank you for the movie. My name is Ana Paula Barreto. I'm Brazilian. I'm a migrant. I live in the US for the past 7 years. And I do a lot of work on racial justice globally. And at the moment, I am the director, hi Christy, I just look at her like, of transnational birth equity at the National Birth Equity Collaborative. I also am part of different campaigns and global organizations that fight against racism. I am also a board member of the Right Women Alliance. Thank you.
Rachel was right at the beginning when she said that we really do have a powerhouse of women here with us this evening, and we're honored to have you. And thank you for the film. If you haven't seen it, I really would recommend that you have a look at it. It's available on Hulu and on Disney Plus, if I'm not mistaken.
It's Disney Plus internationally.
Okay.
And Stars Plus in Latin America.
Okay, so there's lots of different ways that you can watch it, no matter where you are. And I absolutely would recommend that you watch it. And have a huge box of tissues with you. The stories are powerful and they need to be heard.
And there are midwives in the film. You wouldn't necessarily get that from the trailer, but we do talk about midwives. There you go.
Midwives are part of the solution. My first question is for you, Tonya. In your documentary, Aftershock, the maternal health crisis is brought to life by families experiencing it firsthand. Drawing on the real-life stories in your film, can you speak to some of the main issues faced by families navigating the maternal health system in the U.S.?
Yeah, so in thinking about this question, I mean, the first thing that comes to mind is that in the United States, we over-medicalize birth. We treat birth as a pathology, as a problem to solve, not as a natural process to assist and help with. You know, we treat women with too much too soon and then too little too late. And what I mean by that is we're ready to medicalize them, but then when they show up and say they don't feel well or something's not right, they're not seen or heard. And really that's one of the biggest things that we heard, that Black women especially are not seen and heard when they show up to talk about their pain and suffering. People don't listen. The other thing I'll say is that there is too much profit making in our baby making. This is capitalism. And, you know, when you bring money into the equation, there are incentives that are set up that don't necessarily portend to our well-being. And finally, as Jennie Joseph just said, midwives are not at the center of women's health care. And I think that is an abomination. I think that's one of the things that Paula and I, at least I can speak for myself, I wasn't really clear on when I came to the film, but through the journey of the film, I really began to understand how midwives had been eradicated intentionally, how the economics for midwives was taken from them, put in the hands of doctors and men, that aspect of it, but also that you know, they've been demonized so that we all go to hospitals, get treated by doctors, and we're missing, there's a piece that's missing in our healthcare that midwives provide, that they've been providing since the times of ancient. So I think that is a huge issue that we are seeing that families are facing.
Midwifery is the oldest profession in the world. Women have always given birth with other women, and there have always been wise women in communities to support families going through the transition that bringing a new life into the world entails. Thank you. My next question is for Paula. What has been the experience of using the arts in this way to talk about maternal mortality? Are you seeing a shift in how the crisis is being talked about? And how are you seeing the role of midwives coming through the advocacy work?
Yeah, I think the power of filmmaking is really showing the human experience. And as Bruce says in the trailer, you know, he didn't want Amber to be a statistic. And when Tonya and I set out to make this film, it was really important that this was grounded in the lived experience of people on the ground who are affected by this crisis, and the change makers, or so many are here today working for those solutions. So it was really important for us to show who Shamani Gibson was, who Amber Rose Isaac was. These were full women with full lives. And as you said, you know, the ripple effect of losing a mother, you're leaving behind a partner, a family, a community, and the whole nation. Losing a mother is losing a world. And it was really important to show that. So I think through film, that's the way that people could connect, and people who aren't in the maternal health field, who don't know the statistics, they've seen Aftershock, and all of a sudden they're thinking about it in a different way. So we've seen that. Really, the conversations that have come from this film have been the most rewarding, from people giving birth to healthcare providers who in their own systems can't see this because, as Tonya said, there's profit over people. And I think there's a lot of dehumanization that happens in these systems. So I think for many providers, seeing the stark humanity of the people that we're showing in this film was, and I hope is a wake-up call for them. And of course, for whoever seen the film, we do have a beautiful birth, Felicia Ellis, and that is a birthing center birthed by a team of midwives and a doula. And it was really important to have that in the film to really reclaim what birth looks like, because the media does not show that depiction of birth. So all that can be seen through art. And as Tonya said, we really wanted to lift up that experience that's not normally seen.
Taking the information and the statistics that are, readily available, but they don't tell stories. And what you did was you took all that information and you communicated it in a way that really does change hearts and minds. And I think that's one of the key ways to coming to change. It's not, of course, you have to have the information, you have to have the statistics and the research, but without the stories that stand behind that, it really is a moot point, and it doesn't give that imperative to people to see what the problem is. So thank you for doing that. Again, the film is available, and I really, really do recommend that you watch it. My next question is for Anna. With its status as having the poorest maternal health outcomes among developed nations, the US is often spotlighted in conversations surrounding the maternal health crisis. We know, however, that the issues addressed in the film are global and pervasive and systemic. Can you speak to some concrete actions that we need to see on the world stage to reverse the course in the crisis and ensure more equitable health outcomes?
Well, thank you for the question. Very difficult question. First, I want to say that I have a couple of points, but health in the US is not viewed as a right. It's a commodity that if you have money, good for you. If you don't, well, and there has to be a shift on that. This is a right, period, and we have to be treated as such. Then the second point to me is universal free healthcare. We cannot live in a capitalist society where everything is monetized and tell poor people that they need to pay to have access to basic health services. The US has a lot of money that go to war, basically. But at the moment that they decide to shift priorities, and this, of course, is a political will. We are talking about political wills here. We're not talking about resources. We are talking about shifting political will. At the moment that we do that, a lot of the outcomes will change. That's another point. Of course, I want to talk also about racism, because even though when women do have access to hospitals, to doctors, to what we call qualified health professionals, they still die, but unnecessarily meanings, because they are racialized. And there are a lot of things that racism do, but racism is a system of domination, and it's a system of separation that views some people as humans and other people as not humans. And unfortunately, Black people are seen as not humans. And when we are thinking about the health crisis in the US, there is a large portion of that is because we are not viewed as humans. Then I also want to say that as part of the solutions, and when we think about global consequences or even global connections, that's a lot of part of the work that I do. We need to pay people dignified salaries. We cannot, especially after COVID, we cannot have people facing hunger, facing violence, because that's all interconnected. These are all reproductive justice, because at the same time that I'm fighting for the respect of a doctor, I'm also fighting for the police when I stop my partner, for example. And that's why, for me, the conversation and the clip makes me emotional, because part of the conversation is that when we think about reproductive justice, we need to think about violence. And violence is a way to silence women, to silence families. And we as a group are traumatized because we know we have to go through that. In the US, but globally. The difference sometimes in the US is that we have the data. We have films, we have resources to say it. But in Colombia, the same thing is happening. In Brazil, the same thing's happening. In Peru, the same thing's happening. We might not have the same data, we might not have the same resources, but the same things are happening because the goal is domination. And when we start to make those links, we start then to shift to some things. I just want to end, I have other couples, but I just want to end by saying there is a very famous Black Brazilian singer. When she was 13, she went to her first TV presentation because she had a kid that she could not feed. Then the TV presenter asked her, she was wearing very simple clothes. He asked her, what planet you coming from? And she said, I coming from the planet hunger. And a lot of us, a lot of our people in the communities, maybe not people in this room, but our communities a lot of times come from the planet hunger. Thank you.
You make some really interesting points, and when we talk about domination, it's about what's happening to the women who are pregnant and who are giving birth, but it's also about domination to the midwives and not letting midwives have the scope of practice and work that they can and that they should have. In my own work, it's been quite obvious to see how important midwives are and how important they can be if we just give them the tools and the scope of practice that they need to do their jobs well. A question for Jennie. How are midwives, with their philosophy and model of care, positioned to confront the crisis and advance gender equality? From a policy standpoint, can you set the stage for why the current American system is preventing the realization of the midwifery model of care and grossly failing women, and in particular women of color?
Well, I could go straight to the point, I think. Racism, classism, sexism, power. Oh, capitalism. And we are not going to be able to get past that because midwifery, the way that I think it's perceived here, is a threat. And that is a power dynamic. And so the pigeonholing and putting to the side and the undermining and all of the things that have held us back as midwives, not just in the institutions, but in the community as well, they are on purpose. So you can make all the policies you want, but it doesn't make a difference because there isn't any intention to get to the other side, to get to fulfillment of the policy, to get to realization of the policies. There's no shortage of research, like you said. There's no shortage of money. So I hate to be negative, it sounds so nefarious, but to me, that's the truth. And at this point, on the other side of that truth is that people are dying. So what else can we do but say the truth? What else can we do but bring that forward? Because at the end of the day, we can't fool ourselves into having midwifery become normalized. We have to go to the actual bottom line truth. And so our fight is a different fight. It's a movement. It's justice work. Yes. And if you have to put justice on the table, it's a whole different policy. Mm-hmm. Whoops. And if we look at the impact of racism, midwifery was racialized in the United States, again on purpose, because it was, especially since the enslavement, it was the Black and African midwives who delivered America, which the commodity at the time was human beings. So if you have a workforce that was built into a system where your humanity was literally, clearly not going to be respected, the people that were supporting that commodity and that the industry, if you will, were the Black midwives, even though they themselves were still enslaved. But they delivered America. Black and white America. And once post-slavery, we went to Jim Crow because that's what happened. And Jim Crow was another version of having the Black midwives, the indigenous midwives, the immigrant midwives were servicing their communities until physicians figured out, oh, hold up, there's some money to be made here, and took over the process. And they had a powerful way of doing that by bringing in the tools, putting people into twilight sleep, knocking them out, hanging their legs up in stirrups, dragging the babies out with forceps. All of the tools and the tricks that allowed power to be reestablished and to move the midwives out by campaigns of propaganda. Midwives were dirty, unkempt, they were illiterate, they were unsafe. And that public propaganda campaign continues to this day because midwives were racialized. And so people of color especially bear the brunt of that, both as providers, service providers, and as recipients of what's called care in the obstetric. I consider this the fear-based industry of obstetrics in the United States.
Thank you. I mean, all those things are true. As hard as some of them are to hear, when we dig down, that really is what it is. And as you said, people are dying on the other side. So I mean, really, how long can we afford to kind of pander around what's actually going on? We have to start calling it out for what it is.
Well, even if you look at how the film has been able to bring this to the forefront in a way that it has never been done before, this allows the public and folk who are not even interested to consider there's something wrong here, something smells really bad here. But then who is going to lead the charge for what are we going to do about it? This is where the midwives can show up. But we can't go alone.
Yeah.
Every time you look back over your shoulder, like, who's coming? Without that deeply embedded and structural support, we cannot go up against the structure. And a historical and deeply embedded institutionalized racism, classism, and gender discrimination. Those are also institutionalized to the level that it's not even a personally mediated misbehavior or discrimination in that way. It's institutionalized and it's condoned. Therefore, it will prevail.
It's interesting that the medical model of care that is so pervasive in the United States is something that's been kind of almost like something that's been exported. It's something that other countries have adapted, taken in, perhaps changed, perhaps made worse in some cases. Perhaps some of you can speak to some of the systemic issues that are quite similar, no matter which country we go to, even though they may manifest themselves a little bit differently.
I'm just reflecting, and thank you for bringing your comments. This is so important. It's for me, it's very hard to reflect on it because, as a Brazilian, the country was formed under violence against us. So it's very easy to compare to the US, for example, because the racism is global, and again, as a system of domination, it happens in different ways in different contexts, but the goal is always the same. So thinking about we were talking before, and I was mentioning to Daniela how we have this strong conservative movement that always is pushing for now align with very strong political forces globally, because unfortunately we are going under a wave of right-wing governments, unfortunately. Now Sweden just had a very strong Nazi presence, which is something that some experts are saying could turn into Europe. So that's an important conversation, because a lot of the conservative agenda, it's about the control of women. And one way is, let's have this control of hospitals and health policies. Let's push it to illegality, midwives. as the US is doing. So they are under us and we control. And then that's very easy then to dismantle and to even impose things that a lot of the time the communities do not want. That's also part of the truth. And how we can develop those policies, they are very justice-based, dignified-based, that it's also in accordance with what we believe. So in Brazil, after a long history of social movements, I believe, I might be wrong if there are Brazilians here, you correct me, but I believe Brazil is the only country that have a specific national health policy just for the Black population. And this was after decades and decades of pushing for the reproductive justice movements, for midwives, for indigenous communities. And it worked really well until we have a change in the politics. And I keep thinking how we can still, because it's not only about holding the rights that we already have, but we need to advance our agenda. The goal is always advanced. It's not holding and wait for them to come and still get the little that we already have, but it's to advance how we can do that. And a lot of the work that I do is to make the connections and to break different communities together. So what are Black women in Brazil doing that we can share with Black Colombian women, with Black American women, and create a movement that push for a reproductive justice movement that is based on justice. So I do think that there is a lot of the solutions that it is not only community-based, but this transnational community, because borders were also a creation of separation. So I'm going to stop here. I'm talking too much.
And yeah, it's just for me, as you know, in the film, we talk about other industrialized nations that have better outcomes because midwives are more integrated into the healthcare system. But, as you're talking, it just makes me wonder, is that just because it's a more homogenous place? How is it for Black and brown women who are in those nations, I guess, is the question that I really should be asking, right?
The American wretched, miserable statistic is 3 to 4 times as many Black women and indigenous women are dying in pregnancy-related causes in the United States. It's 5 times in England. Yeah, the Black and African descent folk are in equal jeopardy. Why? Because it's the same problem. You see, no shortage of midwives. It's the system. And so if we unpack and dig into why we have sort of 2 things going on at the same time. And I'm intrigued with what you just said about Brazil making a specific Black agenda, because the movement at this point, the fight for reproductive justice, maternal justice, birth justice, is being led by Black women. Black organizations, community-led organizations, folk who are fighting because we are dying. That's a good reason to fight, right? We are literally dying. And what I think needs to come alongside those movements and those, organizations is the fact that, yes, midwifery may well be an answer, but we will work first here. We need to diversify midwifery. We need to educate midwives. We need faculty to teach these midwives. We need funding and investment to maintain and sustain these midwives. We need help. So we could look at, if we're going to work on dismantling structures, that we are more intentional, more strategic about how we do it. Because where we see the Black women and people dying, you'll see that the midwifery is also matching, and that we're not looking at it from that angle. If Black women's status changes, we all win.
Absolutely, and you make a good point. When we talk about places where midwifery is kind of pushed to the sides, and we look at the statistics, we see that there's also problems in access to abortion. We see that there are problems with perinatal mortality and morbidity. We see that there are problems with maternal mortality and morbidity. It's not about the babies. It clearly isn't. There's a lot more going on. No, not at all. I'd like to come back to the film. Paula and Tonya, your film featured advocates and grassroots organizations educating women and community members about midwives and the life-saving care they provide. How do we turn this education into a movement of women and this movement into policy reform for midwifery and maternal health services?
Yeah, I think, Helena Grant, I don't know if she's here, but she's an incredible midwife who I'm sure everyone here knows and is in our film. She talks about that women have to take it back. And I think that that's for the birthing person to understand what options we have, what choices we have. And I think once the consumer understands that, we can demand better care. The midwives, of course, know this, but I think many women and birthing people really don't. They don't know that they have choices. And the more options that we can present, and that was, really the goal with the film, to show that there's different pathways to birth. It's not a one size fits all, and that the bar has to be set higher. We have the lowest possible bar, that if you've survived birth and your baby survived, then you had a good birth. You talk to women all the time and it's like, yeah, my birth was fine. I guess, I'm alive. I had some complications. I needed a blood transfusion, but I'm still here, and we don't talk about that it should be a good experience. So I think what I'm trying to say is that we need a cultural shift here in this country of how we think about birthing, what birthing can be. And then that affects policy and reform, because you need the people who need the care to know what care they deserve.
Just adding to the point that also the care is about paid maternity leave, right? It's a shame that this country have weeks. If you have a good job, 6 weeks of pay. This is a shame. Like, we should be all feeling very shameful for have 6 weeks, and how this also impacts the whole family and the whole community. Breastfeeding, connections with the baby, being stressful about losing jobs. We need to think about those policies as a whole and how we affect the whole community and different countries as well.
And I think to that point of what you and Paula are saying too, is just like educating the public so they know what to ask for, right? Like, the movement is happening. The movement has been happening. There are amazing people out here that are here in this room who are doing the amazing work, but it's the general population that doesn't even know what the issue is. They don't even, first of all, they still think midwives are scary old witches that should be burned at the stake. They really do. And so they don't even know what midwives do. I mean, so many people do not know even the difference between a midwife and a doula to even begin to understand what they should be asking for. And you talk about paid leave, people don't even understand the connection to that, to birthing outcomes, And so if the public is not educated, then how do we galvanize everybody to really get to the place where we improve the outcomes for us all and the policies that we need?
Yeah, and one more thing to add to that, because we were all talking about this earlier, is, what is full spectrum reproductive health care? It's all one continuum from menstruation to menopause. It's one conversation. I think one of the greatest failures of white feminism, and there are many, is that the separation between abortion care and maternal health care, that it's like these two separate binaries, and they're two separate conversations when we all know it's one conversation. Maternal health care is abortion care, is health care. So I think we need to, erase the gaps and talk about what full spectrum maternal health care really is.
It brings us back to what the PUSH campaign is, and that is that midwifery is a movement. And it's an integral part of social and reproductive justice. And that without midwives, we can't have thriving communities and we can't have thriving families. We've got a few minutes for questions, if I'm not mistaken. If anybody in the audience would like to address the panelists.
Thank you. This has been an incredible panel, one of the best I've ever been to in years of UNGA. So just really delighted. I have so many questions, but the first one I was going to ask, you made the comment that when we're talking about justice, it's a completely different policy. And what I've noticed so much in the maternal health space and in midwifery, there's just this desire to approach things completely through a technical policy lens, a technical advocacy. Let's do more training. I'm curious, what do you think are like the big policy shifts and changes that we should be asking for to really transform and elevate and truly address the issues that midwives are facing and their patients are?
I think we have the policies down. I mean, there's the Maternal Health Omnibus, which is an amazing set of bills, covers everything that needs to be covered. It's all there. I just think that the difference between policy being written and actually being actualized is night and day. And that's where I get tired. Like, what is the point? Like, we've got a whole new blueprint. Isn't that awesome? Okay, and? Like, what's next? Right? We keep going in these circles where we write it down, we know what, I mean, the most comprehensive approach, I think, is bringing in the justice aspect. So that is including, there's I think there's 10 bills, including COVID, but there's technology, there's moms in jail, there's military moms, there's postpartum depression, there's which of those service workers, doulas, childbirth educators, lactation, midwives, everything is in this omnibus package. It's awesome. And here we are. Even if it passes, what does that mean? If we don't want to look at it from the angle of it gets stuck around whichever table and goes into whichever ether, and the folk who are ready to receive these funds and do with them what they need to do are still shut out. So on a local level or a state level, same thing happens. So money might get earmarked, but it just seems to fall into the hands accidentally of the same folk doing the same thing. And so we don't have access points to really be able to take those policies and translate them into change. And that's the problem. So I think it's more about, not that we need different language, different smarter ways of saying the same thing. We are fine, we got plenty, no shortage. But until we can translate that into reality, people will still keep dying. And while we talk about mortality, I just want to add morbidity, which we don't talk about a lot or enough. The numbers are outrageous. It's not 50,000 near miss. It's probably 500,000. It could be 1 million. There's 4 million births a year. But the amount of people who are suffering and struggling because why? Oh, policy, right? Oh, let's take your Medicaid away at 6 weeks. Oh, no, now we're going to give it to you for 12 months. Really? Well, who's going to service you anyway, whether you have it or don't have it? Like, this is where we keep falling short because we won't make that next step to the practical application. Who are the people who are going to be delivering on this care? And are we really willing to support them? Or are we just going to keep going back to the table and talking? So there's so much in there, but I mean, it's a good question. It makes sense to ask the question. But I think we then need to be willing to really take the answer back, come back up around, and make that change. And if we don't do it, who's going to do it? Anybody coming? I mean, what are we going to do?
That's part of the reason why the PUSH campaign is a decade-long campaign, because this is not a really easy thing to solve. And we were actually talking before, we were talking what comes first, the chicken or the egg? Do we open the midwifery programs or do we educate the midwifery educators? And it's so complex and there's so much to do. And I really hope that we'll be able to do it over the next 10 years. Yes.
Hi, my name is Eugenia Montesinos. I am a midwife in New York City in a public hospital. And I think one of the things that we have about midwifery, midwifery is an oppressed career. And midwifery, because we are women, they can oppress easily. And that is one of the main things that we have. And not only here in the United States, but it's around globally. Globally, that is a big problem that we have. And they can oppress us easily. So now I work in a hospital, we have policies. Who makes the policies? They're not women. They're doctors, they are male. They have no idea what is, when somebody have to check you, what pain you're gonna feel. And that need to change. Women need to be completely involved in all the policies that we make. And another thing, we are not midwifery is not integrated in the United States. I work in a hospital. I work under the orders of a doctor. I know many things that I can do for a woman, but yet I have to follow orders. It is more aggressive for a woman. There is obstetric violence. There is so many things that we have to, and we are in between. We have no idea what to do. Should I follow just the orders, or should I lose my job? What is it better? And I've been working for the past 22 years, and there is so many things we do, and there is so much that you do and you defend, but it is hard. And it's hard because it's an oppressive career. We oppress every single word because we're women. And all the directors are male. There is no women director. For me, if we want to have the midwifery model, we have to have a department of midwifery independently, and show the difference, show the outcomes, show the happiness of the woman, of the family, the economy. We are more holistic. When I see a woman, I'm not seeing her vagina and her belly and when she's gonna have a baby. I wanna know everything what is happening with her. I wanna know if she's being abused. I wanna know how she got, when she got pregnant, maybe she didn't even want it. Maybe she was raped. There is so many things that a woman, when she comes, it is much more just to see her. It is an array of things that it's gonna do, and how she's gonna go to the pregnancy, and how I'm gonna plan with her when she's gonna have the baby. And I know how I was gonna do it if she is a rape victim. There is so many issues. Not only having in a pregnancy, what is gonna be her delivery, and what is gonna be in postpartum. That she has help, who is gonna be with her? So in any way, at the end for me, it's an oppressed career, and we need to change the woman. We need to change the thinking. We need to change since very little. We have the power of our body, and we have to demand it what we want. And I think that is that.
I want to just thank you for speaking and sharing vulnerably like that, and just pointing out, I think this is any midwife anywhere in the entire world. You spoke for all of us. And that's where we can do work here differently in terms of looking at what is the structural support that we're going to need to pull this forward and move this campaign. Without that, we are going to continue to be in this cycle, right? So we are providing trauma-informed care. That's what we do. We do that automatically. But we are suffering vicarious trauma. We are suffering moral injury. We're suffering at the hands of a system because we see the oppression, we see it's wrong, but we are feeling powerless to do it, to change it. Hopefully we can build power to do that change. But I really feel like that unless we do a strategic approach, we'll end up being here for another 20 years with the junior midwives coming right behind us saying the exact same thing.
Thank you. We have time for one more question.
Good evening. As a Black midwife in America, 25 years later, still practicing amongst my other hats, my question is to the filmmakers. This is not new. Since I moved to this country, I've worked in poor immigrant neighborhoods. It was happening 25 years ago when they recruited me. The difference that I'm seeing and hearing now is that maternal mortality is now sexy. It's dramatic. It's newsworthy. The problem is now picking up on even what Jennie is saying. I'm really angry, actually, sitting right here. I'm pissed off. Because what's not happening, and I'm worried about films and all of this other stuff, because what's not happening is now we're seeing the pushback from the women. No one's talking about that. The bulk of midwives of color work in hospitals in the United States of America. Bottom line, we choose to work where the women are. Medicare, Medicaid, all of that stuff. So on the one hand, the birth center is pushed as the ideal, which is not real. Keep it real, it's not real. Then the women are now, because of the fear is now the ruling thing. So even when midwives working within hospital systems who have the best interest of the women at heart, when you have 41 weekers refusing to be induced with zero fluid because hospitals, hello, call it sister. That is the reality of films, media, all of that that's happening. So how can we pull that back? It's already happening, and it's burning more Black and brown midwives out more quickly because more don't want to do it.
Thank you for your comment. I really appreciate that. And it's something that, we talked a lot about in making the film, because the last thing we wanted to do was to contribute to women being afraid to give birth. I will say that part of us coming together is in 2017, 2018, there were articles that were coming out finally about maternal mortality and morbidity. Yes, we've been knowing this has been going on, but it was starting to come out. And for me, I really wanted to get in and make a film because I knew it was coming. I knew, and there are more that are coming. And I think it's important that we tell these stories, because if we don't talk about it, then we can't fix it, right? We have to be able to have conversations, and I really do see the film as a conversation starter to talk about what's going on in our communities and how we can make it better. You saw the trailer, but I want you to know about the film. It was also really important that we show a birth, and yes, it's in a birth center, and yes, it's a beautiful birth, and yes, it's the birth that we would all hope to have. We were lucky to catch it. I mean, you can't control it. It just happened to be the birth that we caught, because we did want to show what is possible. But it's a conversation, and we have to have it. We cannot put our heads in the sand and pretend that this is not happening as a community and a world. We have to be able to have a conversation about it. But I will tell you, the last thing I want is for women. I want lots of Black and brown babies in this country. We're such a small part of the population to begin with. I want lots of women to have lots of Black and brown babies. I want them to feel empowered. I want women to come away from the film understanding that there are options and choices. Now, I can't control how people feel when they come from the film. But my hope is that they come away from the film feeling inspired, educated, and at least have some knowledge to be able to go out there and make a choice for themselves. Because I also don't want them showing up to a doctor or a midwife just saying, tell me what to do. I mean, I think at the same time, I think the consumer, a woman, should be empowered to know what's happening with her body, to be able to make the choices that are good and right for her in partnership with her healthcare provider, so that they can find the right choice for her. So I hope that the film somehow gives women some thought and language to start thinking about how they are now working in partnership. Yes, they may push back, but how, and maybe it does make the job a little harder, because now they may push back, but how now do you have a conversation with a woman that helps her be empowered in her choice, as opposed to just having to listen to, oh, well, they told me to do it, so this is what I'm doing. At least that's how I see it.
Yeah, I see it the same way. And the goal of the film and the goal of what we want for birthing people is to have a dignified birth in whatever birth they choose. You can have a really dignified C-section if that's what you choose. And I think another part, and I agree with everything Tonya said, is really highlighting the midwives, all of you, because we talk about the history of midwifery, how midwifery was eradicated in this country due to a really successful racist marketing campaign, and that's a history that many people do not know. And I think what you're saying, the conversation that you're bringing are the conversations we need to be having. I mean, when we set out to make the film, we considered including the licensure barriers of midwives. That was a big part that we wanted to include, but ultimately could not. And it's clear that in this country, it's so divided, and that division takes away power, because when you divide a community, there's no power in it. So if midwives are all on different paths and there's infighting with midwives, then there's no power there. And that was something that we're very aware of. So I think the conversation is for birthing people, but it's also for midwives like you to say exactly that we need to be really careful about that. We don't want women not trusting their providers. Trust is something that has to be nurtured. It's not a given. You can't walk in and expect, just because you're in a hospital and these people are supposed to be experts, that trust should be there. It has to be earned. So I thank you for this, because I think that's a really important point. I don't think we support any unsafe birthing options. I have high-risk pregnancies myself. I would not give birth at home, but I think that many people can. So I think there's nuance, and the problem is that we don't talk with nuance when we talk about birth. So thank you for bringing that up.
On behalf of the Push campaign, thank you so much to our panelists for an amazing discussion. To close out the session, I want to provide a few notes on some of my takeaways from what we were talking about and how we hope to move forward in consideration of the insights that we've shared tonight. If we know that midwives are a cost-effective, critical solution to improve health outcomes and experiences for women, newborns, and families, that reduce health inequities in access and quality and provide the continuum of sexual, reproductive, maternal, newborn, and adolescent health care, as our panel noted here today, why aren't we funding the profession? In order for midwives to achieve their full potential and address the issues brought up by the panelists in today's session, we need a global, yet local, tailored push to drive awareness and funding towards this vital workforce. We need a social movement. The Push campaign is a mechanism through which local and regional partners will be able to scale and coordinate their advocacy efforts and achieve the funding and policy wins to dramatically improve health and well-being outcomes for women and communities. As leaders convene for UNGA and with less than 10 years to meet the SDGs, there's no better time or location to launch a campaign aimed at funding a group of health professionals devoted to providing, upholding, and advancing sexual and reproductive health care. This conversation has demonstrated the pervasive nature of the maternal health crisis, which crosses oceans and income brackets and disproportionately impacts already marginalized communities. The good news is that we have a solution. And in this room tonight, we have the power to action that solution and the power to push. Thank you for being with us. Thank you to our panelists. Thank you, Rachel, and to our other speakers from earlier this evening. This concludes the formal part of our evening, and we invite you to a reception in the front foyer. Let's keep the conversations going.